welcome you all on this seminar. Today's our seminar is on healthcare management beyond textbook. Why I choose this topic? Because as you all are healthcare management students, you all go through different textbooks, you know about quality management, safety management, what all are healthcare infrastructure, hospital planning, designing. There are lots of books available. So the idea is I am not going to repeat that books. Whatever I today we want to interact is on the practical aspect, which I believe that you will not find in any of the textbook. Why? Because it is not an academic thing. It is based on the experience you learn. And management is all about experience. It is all about perception. It is all about how you perceive and how you going to manage particular situation. That's it. No matter whatever the university or whatever the institute, wherever you are passed out, whenever you are working in a hospital, you will be counted as in a different situations where you are not going to allow to open a textbook to solve this situation, right? So are we clear? I mean, am I connecting rightly? Okay, good. So you all are master of hospital management students. So may I know what all are, what do you know about healthcare industry? Anything you, uh, every industry has a different sectors, right? And all the sectors are contributing to that particular economy. So in our case, there is a healthcare economy and different sectors are contributing differently in that particular economy. For example, right now we are at Department of Hospital Management, HNG University, right, Patan. So it is an academic institute. So what this institute is contributing into a healthcare economy by providing talent to the industry. So that way, academic institute is one of the sector in healthcare. So you say medical college, nursing college, etc. Academic institute is the one of the sector who is contributing to the healthcare economy. Now, what all are other sectors you can think about in healthcare industry? Start. So I'm going to write down, and even you can put it. One is academic institute. Who all are other sectors contributing to healthcare industry? Yeah. Notes. Pharmaceuticals, right? Next, surgical क्या? What surgical? What surgical? Be specific. Surgical nursing, surgical oncology, surgical instruments, surgical things. What? It's not a sector, na? Yes, healthcare, IT or tech. That's the sector. We are talking about sector. Don't think about the speciality. Hospital management is a speciality. It's a subject, right? So, healthcare, IT, like Docthub. Docthub is part of this sector. It's a healthcare career and professional upgrade platform. That way, other tech platforms who are providing for online consultation, telemedicine, digital health, kind of, right? Digital health is another sector that we will, what is the difference? Let's see. What is the difference between 3 and 4? Fundamental difference. Don't give the textbook definition, etc. You can, and yes, you can speak in Hindi, Gujarati, or English, whatever way you like to. Learning should not be restricted to the language, or you can speak. क्या आपको लगता है whatever कुछ तो थॉट होगा कि healthcare IT and tech is one of the sector and digital health different sector. क्या फर्क क्या है दोनों में?
मीन्स हम अपनी हेल्थ कोई किसी टेक्नोलॉजी के थ्रू कैसे चेक करते हैं, लाइक ये जो स्मार्ट वॉच हम पहनते हैं सिमिलर.
Yeah. So fundamentally you are right. Here we are considering different software which is being developed. Yeah, hospital information technology kind of software. There might be software in pharmaceutical to manage pharmaceutical production, etc. There are healthcare research and statistics softwares, right? So these are the technology tech which is meant for the healthcare professionals to do their work conveniently, comfortably. So these all the technology, even in health technology, there are medical devices, innovations going on with the technology. So there's all our healthcare tech part, right? And here digital health means these are for the patients I'm talking about. And these are for the businesses and units to use software or technology for their professional work. These are basic difference between here the end users are professionals, here the end users are patients. Yeah, robotic surgery, robotic equipment, these are health tech, right? Good. Next, and the list is 1880, no? So we have still yet reached to the 4 only. Health insurance, right? Come on. But that's the subject, na? Healthcare equipment and supplies, that means there is a sector of medical devices, right? Medical device sector, good. Then MHM. Medical tourism, but yes, but that is one of the major things is still required. So I'll come to this medical tourism part. It is one of the part of one particular sector only. So we can which course you are doing? Master of Hospital Management. So there is a word hospital. The industry, so healthcare industry, how can you, no, hospital is a sector, na? They are contributing for the healthcare services. So here, medical tourism, as a part of medical tourism, we will going to provide a service, hospital. Here you can include hospital, clinics, all are providers like rehabilitation centers, physiotherapy, dental, etc. But there is a unit the sector who are providing healthcare services to the patients or a needy or kind of. So tourism, maybe international patient service, uh, other medical services or high-end super specialty services. Again, it's one of the part of. Ultimately, sector means how that particular sector has a particular role in the healthcare economy. So here we include also medical tourism, as that was a good part from ma'am. टेलीमेडिसिन आपका आ गया ना डिजिटल हेल्थ में आ गया ना, वो पार्ट वन ऑफ द पार्ट ही है, पर आप उसको सेक्टर नहीं कह सकते. इट्स अ सर्विस. टेलीमेडिसिन, ऑनलाइन लेबोरेटरी टेस्ट, ऑनलाइन फार्मेसी ऑर्डर, you give like pharmacy, e-commerce, that's the sector of digital health. You are accessing healthcare from digital point of view, from digital, like either you are using mobile app or website, you are ordering as a patient or as a end user, you are ordering for the service, whether you want a home blood collection or medicines or online consultation. Now you understand what the sector means in the industry. I mean, next. Rehabilitation, yes. आप उसको ले सकते हो. रिहेबिलिटेशन मीन्स आप हेल्थ केयर सर्विस ही दे रहे हो ना पेशेंट को. तो यहाँ पे आप उसको एक वन सेक्टर है जो हेल्थ केयर सर्विस प्रोवाइडर ओवरऑल कोई भी, मतलब आप यहाँ पे all the healthcare service providers, they are providing services to the patients or users or individuals. Yes, research organization. Research organizations. फिर any kind of research organization, either it is pharma clinical trial, whether it is like yes, any research for the related to vaccine, research related to virology, bacteriology, research for the um, they do research on healthcare statistics and developing a policy, but ultimately they are doing research. Particular organization, they are doing research, and their contribution to healthcare industry is different. So that's why we are considering it is as a different sector. I mean, all the research organizations contributing healthcare economy, they are putting their with their contribution, they are making it valuable for their research, etc., wherever they using it. Now next, till there are 10. Yeah, please come. So there is one thing let me clear. You can, if anyone want to go for a water or a refreshment, no need to ask the permission. You can go, move out and come out, no problem. Outsource what? It's just a word, but what? नो बट अब हेल्थ केयर इकोनॉमी में कैसे आप उसको कंट्रीब्यूट कर रहे हो, उसको कनेक्ट कीजिए. We are but ultimately they are service provider, na? You mean to say security service, housekeeping service, kind of?
I think integrated services. There must be integration of something like doctors, pharmaceutical. Even nowadays, many firms are providing the integrated services.
Yeah, so the service sector, consultancy service kind of, we can call it, right? Okay. There are consultancy service contributing to the healthcare economy, right? So whether consultancy service or the service firms, you can lightweight like so healthcare consultancy gives services for the recruitment to the hospitals, for quality accreditation, for any other certification, for planning, for designing, etc. But the consultancy is a separate sector in a healthcare industry. Now, गवर्नमेंट स्कीम्स पर वो तो एक सेक्टर बोलोगे आप उसको, हाउ, उसको एलेबोरेट करो क्या, सेक्टर किसको बोलोगे, सेक्टर नाउ आर वी क्लियर कि आप सेक्टर किसको बोलते हो, इट शुड बी यू नो देयर सिग्निफिकेंट रोल इन इकोनॉमी, हेल्थ केयर इकोनॉमी आई एम टॉकिंग अबाउट. तो आप गवर्नमेंट स्कीम्स है पर आप उसमें इफ अ सेक्टर है तो आप उसको अलग से कैसे डिफाइन करोगे, इंस्टीट्यूशंस ही है ना, लाइक गवर्नमेंट इंस्टीट्यूट्स मेक पॉलिसीज स्कीम्स एक्सेट्रा, राइट? सो academic institutes or any government departments, any who contribute for the policy, for the talent, for new thought process, for any kind of new rules, regulations they are putting in the industry to control, to operational, to make it standardized, etc. So the word institute means what? Okay, next we'll see it later, but still there are 9 different sectors you guys need to think about. After MHM, in your senior batch, what they are where they are joining, I mean whether they are going for a hospital or a public sector. So there is public health. Yes, okay. So you were talking about the schemes where you you collectively call it, but it's not a sector. Public health is a sector. Why? Because their contribution is different in the economy. Public health will be like government healthcare setups, government healthcare schemes, vaccinations, etc. Different programs like yes. So here treating, I mean the preventive as well as both, but public health is a different sector in the industry. Good. Yeah, so that is a different part. Their role is different. Healthcare NGO. Healthcare NGO sector is different. Why? Because they are also, you will see, there are disease specific NGOs. There are talent related NGOs. There are professional community NGOs, right? So it's a different sector. And it includes different associations also. medical associations, no, nursing, paramedic associations of different specialization, etc. But they all are healthcare NGOs. They are non-profit organizations, not being controlled by government or any private firms, but it is group of people contributing to the healthcare economy differently. Good. Next, any idea? Um, Diagnostics can be a separate sector or not? Diagnostics. Just like pharmaceuticals, diagnostics also has a clinical support role in the industry.
MRIs,
Yes,
scans, these are
right. So,
so actually they differ from the hospitals.
yeah,
That's why they are included in another sector.
like MRI machines will come into this sector, medical devices, but it is going to used by different service provider. Diagnostics are also uh, in laboratory science also entire you can use it. Diagnostics in terms of um, talent, you can say that like there are different professionals in the diagnostics. So diagnostic is not only the pathology and radiology, but there are diagnoses in high end also. You can say like virology, bacteriology also is microbiology. That diagnostic sector is vast. So we can consider as like pharmaceuticals, we should consider as a separate sector. We can consider it because if the diagnostic sector is not there, they are contributing to strengthen the healthcare services better. The accurate, more the accurate diagnosis, the more the clinical outcome will better. Like more the pharmaceuticals are more quality oriented, you get quality drugs, etc. Your clinical outcome will be different, right? So that way they are making a significant role. They have a significant role in the healthcare economy. Good clinical outcomes saves your energy, your money, etc. So, so always sector in a particular industry, you should look that what is their contribution to the economy and how it is going to create the value to entire ecosystem. This whole sector is create a healthcare ecosystem. Okay, so there are blood banks and tissue banks are there. We why we I consider it other than diagnostic. It is not a diagnostic part. Blood banks and tissue banks. Anyone know about tissue bank? It's a in India there are less number of tissue bank you will observe, but in Western country and nowadays there are each type of tissues. There are different banks. You might have heard about stem cell banks. There are skin bank. There are sperm bank. There are different, any kind of tissue other than blood, they store it, and it has required a unique set of infrastructure. There are licensing and standards need to follow, and their contribution to healthcare economy, it is again a significant role, because you are providing, they are create their role is significant in terms of contributing towards the advanced medical treatment, right? So, okay, blood bank, blood and tissue banks. And why we are talking about this, all the sectors, at last I will come to that point, why we have discussed all these sectors. Anything else you differently now you can observe in healthcare industry that this could be the separate sector we should consider? But they are government agencies, right? So again, we can put institutions, because ultimately the institutes makes the policy standards, etc. Whether they are government institutes or a private institutes, all contributes to the talent, policy, standards, right? We can consider the sector in terms of here you can add government agencies, the controlling licensing agencies, authorities, etc. Because they have, like, for example, local civic body, they controls all the hospitals and healthcare providers, they are issuing the license to practice, etc., right? So they have particular uh, you know policy or a rule. It's a part of a rule. If you want to run a shop, you need to get a license of shop and establishment act, etc. So we can consider as a sector, not a different sector, but I think academic institutes who have defined that particular rules can be considered. Medical legal, again, it's a subject, right? Where it applies, whether it is at a hospital, it applies to hospital, it applies to clinic, it applies to medical practice, it also applies to diagnostics, lab, it also applies to blood banks, tissue banks, right? So that way it's a subject, it's a policy. Ambulatory service, yes, but again इसको आप हेल्थ केयर प्रोवाइडर ही है ना, वो हो गया हेल्थ केयर प्रोवाइडर ही है ना, कि वो, हाँ, एक सेक्टर आप गिन सकते हो, एक है सेक्टर होम केयर एंड एम्बुलेटरी, इसको यहाँ पे हम ले सकते हैं. Home care, nowadays there are home nursing care is there. Their contribution is different other than healthcare provider. Here, patient has to go to that particular hospital, clinic, or rehab center, etc. But here, the service is provided at your doorstep, whether it is home nursing care, home care assistance, like for the elderly patients, there are people, they have assistants, they provide just a routine work, also assistance. Home care, kind of you are for home blood collections, home physiotherapy, home healthcare counseling differently. Uh, but such kind of is things has contributing differently in the healthcare economy. So we should consider it as a separate sector. Whenever their purpose, the particular unit or particular sector is contributing differently to the industry, we can consider as a sector. And as such, there is no any such textbook definition what is sector, what is industry. So it is purely the academic discussion, and to create a thought process surrounding healthcare industry, to look at healthcare industry from a different perspective, from a different lens. That's why we are discussing these sectors. So yeah, home care is, you can consider. So there are now around 4 is left from my list, I think. Okay, one is retail and distribution. In this sector, why we see, ultimately, you see, pharmaceuticals, they are manufacturing drugs, but they are giving it to the retail and distribution supply chain. But they have an important role in supply chain. Same wise, same in medical devices, again there will be a retail and distribution part will be there. But that retail and distribution as such, they are making, they have a different role in the economy. So that's why I consider it as a separate sector where we should look at. Then one sector is alternative medicine. Again, it's alternative medicine, alternative remedies, but there is yes, all type of IUs. Nowadays, you see naturopathy centers, yoga centers, uh, wellness centers, right? They are creating a different services. Even if, the healthy person also go there to release his craze, like, health and wellness center, where, why you go, I mean, for your weight control, for diet control, for uh, in your routine life, you are getting more, you are more stressed, and they go to such centers. So their role in the industry is very different. So यहाँ पे we can consider wellness, naturopathy, yoga, etc. So all they created the different role in the economy. Right now, 2 are left. Anyone have you heard about hospice? Anyone? What is hospice? Okay. There are long-term care centers, long-term or elder homes, kind of. Hospice means people who are suffering for end stage diseases, whether it is cancer, organ failure, etc. Now, so in their end of life situation, where it is difficult to manage that patient at home, at hospital it is a cost burden, economic burden, because only they all they need is few medicines and nursing care, and some kind of medical counseling and things which is in their. Here the idea is the patient who is suffering for such diseases, in the last days and last few months of period, the hospice centers provide such kind of nursing care or medical care, some medicines, or make them more comfortable, painless, and life. That's the purpose of that hospice centers. So and long term care centers in India you will not observe such kind of, but in western country there are long term care centers for cancer patients, for psychiatric patients, for usual psychiatric patient. There are mental health homes, sorry, but organ failure patient, but still there is a hope, and they require long term care, or mainly it is old age centers where last in their life, last 5-10 years of their life they spend in the long term care centers. Because if they are if a patient or a particular individual is suffering from chronic disease like liver, kidney, etc., so they need a regular basis of nursing care treatment, like dialysis, some kind of procedures, some regular medical consultation, etc. So long term care centers provide that nursing care through year on year. Also they provide the assistance for uh, going to the hospital and then again come back, continue treatment, doctor visits, etc. They manage all the part, so family members need not to be worry about their care and all regular basis on year. And lastly, there are publication houses, healthcare publication houses. Why this sector should consider? Journal, right? Although there are research organizations, they do research. There are institutes, they create policies, standards, etc. But these publication houses distribute this research, distribute this knowledge to the communities, particular communities, professional communities, etc. So that way, their role is significant in a healthcare economy. So I think we should also consider publication as a separate sector in healthcare industry. So, so yes, why did we this exercise? Why? Because as you are in doing MHM, after completing your course, you will start looking for your for different jobs, your different professional role, etc. So I wish and I think you you all should look at different sectors, identify your area of interest, your passion, where you want to work for. Your role should not be stick to the hospital and public health sector or healthcare consultancy. I think these three, four are commonly seen among your seniors and all. But yes, all these sectors you can find your role, because in all these sectors they will need competent managers, leaders to take their unit, take their business forward. So that's the purpose of discussing these sectors. Any suggestions, anything we can add in this list? Because there is no any textbook things, no any fixed rules that how many sectors include in the healthcare industry. There is no any such things available. So it is all about our perception and our things, how we can see the healthcare industry is. So I hope that 18 sectors in healthcare industry you get it uh, uh, very well, and I hope I have clear the message which I want to give you for your next future career options. It will help a lot, right? Thank you very much.